This segment sponsored by GBMC Healthcare.
Welcome back. So have you heard about superbugs? Do you know where they come from?
Oh, it is kind of crazy to think about. I stopped by GBMC to learn more about antibiotics and what we need to know. I'm here at GBMC chatting with Nasir Rizvi, the lead antimicrobial stewardship pharmacist, and we're so happy to chat with you. Thanks for being with us.
Thank you for having me.
Of course. So are antibiotics becoming less effective?
Yeah, so most antibiotics can become less effective. Antibiotics in general inhibit the growth of bacteria. They can also kill the bacteria that's causing an infection. And resistance is essentially the bacteria developing or finding new ways to protect itself against that antibiotic. So essentially it becomes immune to the effects of the antibiotic.
Oh, interesting. So then what is a superbug and how does that happen?
Superbugs are essentially more resistant bacteria. So they're resistant, or they develop these defense mechanisms against many of the commonly used antibiotics that we have today.
Okay, so talk to us a little bit about how that causes resistance.
Sure. So bacteria, whenever you have an infection, there's lots of bacteria in your body. So whenever you give antibiotics, some of those bacteria are killed by the antibiotic. Sometimes some bacteria become resistant, or they already have defense mechanisms against that antibiotic. So those ones, when there's no good bacteria around anymore, those bacteria continue to proliferate, continue to grow, and they cause more infection. So those are the drug-resistant bacteria. And then eventually those drug-resistant bacteria can actually spread their mechanisms to other bacteria, and then those can be spread to other patients, to other people, and that can, again, cause more resistance and more superbugs.
So, in your opinion as a pharmacist, how can we maintain the efficacy of antibiotics when we're using them so frequently?
Sure. There's actually a lot of things that everyone can do. We should all be good stewards of antibiotics. So, firstly, as patients, we should use antibiotics only as our doctors or healthcare providers tell us to use them, only when. Should never save antibiotics for later. Should never share antibiotics for later. Antibiotics are really only for bacterial infections, so they shouldn't be used for any viral infections, such as the cold, cough. Most sore throats are usually viral. Bronchitis is usually viral as well. So never use antibiotics for viral infections. There's a lot of common bacterial infections that also don't require antibiotics, such as bronchitis, some ear infections, sinus infections, especially going into this winter season. Many times when antibiotics are used, you should also use the most targeted antibiotic. So think of it like a Swiss Army knife. It has a lot of tools, right? Some antibiotics are actually just like that. They're really broad. They kill a lot of bacteria. So sometimes we need those antibiotics, but a lot of times you need just that one tool that kills that bacteria that's causing your infection. So that's really one of the most important things to also prevent resistance, because those broad spectrum antibiotics are going to kill a lot more bacteria and cause a lot more drug resistance.
This is just fascinating. Thank you so much for taking the time to chat with us today.
Thank you.